Hey, here we go, everybody. Welcome, welcome, welcome. We are truly honored that you are all here with us today. My name is Christopher Shaw. I'm a licensed psychotherapist in the state of Texas, a trauma and addiction specialist, and a recovery professional with nearly 2 decades of experience working with addiction, trauma, compulsive behaviors, nervous system dysregulation, and identity reconstruction. And today, I'm not only here as a clinician, but as someone who personally survived severe PTSD, addiction, collapse, and profound internal fragmentation. So, how many of you here today have experienced trauma in your life? If you're on camera, you can just raise your hand.
Or just use a little raise hand feature. I don't know. I don't think anyone gets through life without experiencing some trauma.
Right? And how many of you have struggled with addiction or escape or even betrayal trauma, which I have found to be so insidious? And how many of you have been working on yourself for years? Many of us, right? We welcome you, we honor you, and we are truly grateful that you are all here. This webinar is for all of us. And over the past several years, one of the most transformational elements in my own healing journey has been my work with psilocybin and sacred earth medicines, alongside psychotherapy, spiritual practice, nervous system work, community, embodiment, and deep integration.
And I am Aeon Archer. My background is in trauma-informed spiritual care, embodiment practices, integration work, and transformational facilitation. Today's conversation is not about promoting reckless or on your own psychedelic use. It's about exploring what happens when trauma healing, nervous system science, emotional processing, spirituality, and psychedelic-assisted recovery intersect responsibly, ethically, and intentionally. And we also want to clearly state this webinar is educational only. Nothing shared today is medical advice. Psychedelics are not safe or appropriate for everybody. And healing is never about simply taking a substance. Real healing requires preparation, support, safety, honesty, integration, and the ongoing inner work. And be sure to stick around until the end of this webinar to receive our gift booklet that is called Psilocybin, PTSD, and Addiction Recovery, a guide to trauma healing, nervous system regulation, and psychedelic-assisted recovery.
So one of the biggest mistakes society makes is treating addiction as the primary problem. Many of you probably know that. In many cases, addiction is the survival strategy, but trauma is the wound underneath it. For years, mental health and addiction treatment focused almost entirely on behavior suppression. How do we stop drinking? How do we stop using? How do we stop porn? How do we stop relapse? How do we stop overeating? How do we stop self-destruction? But many clinicians and researchers are now asking a deeper question. What unresolved pain is driving the behavior? What nervous system state is the person trapped inside? And what happens if we help people process trauma differently? That changes everything because PTSD isn't just memory. PTSD is physiology. It's stored survival energy. It's hypervigilance. It's dissociation. It's shame. It's emotional numbing, and it's nervous system dysregulation. And many addictions function as attempts to regulate unbearable internal states. Alcohol, porn, sex, workaholism, drugs, food, validation, and control. And many people are not addicted to pleasure. They're actually addicted to the relief that it provides. And when trauma remains unresolved, the nervous system often becomes trapped between hyperarousal and collapse, fight, flight, freeze, and dissociation. So the question becomes, what actually helps the brain and body process trauma in a new way? That's where psychedelic-assisted therapies are generating enormous interest right now. So before we go into the science, I'd like to share with you a little bit about my story. For much of my life, I looked pretty functional. I had many successful careers. Once I entered recovery in 2008, I started helping others. I was always a high achiever, capable, strong, but internally I was carrying enormous pain. Trauma, shame, addiction, emotional fragmentation. My nervous system was exhausted, and I carried a deep, profound disconnection from myself. My trauma began really early when I was a young child with some early childhood sexual abuse. I was raised in a violent home. I had a violent stepfather who was physically abusive, sexually abusive, emotionally abusive. And then as I entered my teenage years, I found myself in other sexually abusive situations with older people. And then in college, I experienced a sexual assault, and the list goes on and on. In 2008, I hit bottom. At that point, I was using a lot of drugs to cope with all of my trauma. And at that point, I had done very little therapy. And in 2008, in New York City, in this basement apartment in Harlem, I said, enough is enough. And I heard a voice, and that voice said, get help now. This is not what you're meant to do with your life. 3 days later, I was on a plane heading to Florida where I entered the behavioral health of the Palm Beaches for addiction and trauma treatment. While I was there in 28 days, because as we all know, insurance providers think that we can cure addiction in 28 days, so that's what they pay for, and that's what they paid for me. But thank God it was enough, and thank the universe I followed my aftercare plan to a T. Right? When I was in treatment there, I was really fortunate to experience EMDR, which is a beautiful, beautiful trauma therapy that has a lot of years and research behind it. And it really helped heal a lot of that childhood trauma. It wasn't all gone, and there wasn't enough time to do as many sessions as I needed. But they gave me a really strong aftercare plan. And when I returned to New York City, I decided to move to Canada, where I was going to enter school and become a social worker. Because the one thing that my early recovery tuned me into was my purpose in life, and that was to help others recover from this horrible disease of addiction and trauma. And so at 5 months sober, I entered Wayne State University, the graduate program, and got my master's in social work, which was just beautiful. It was so beautiful, specializing in addiction and recovery and trauma. During that time, I was in the field immediately and got to work with so many addicts in recovery at different levels of care, which was really beautiful. After I graduated from Wayne State, I moved down to Texas because I thought it would be better to be closer to family. And so I moved to Austin, and I worked at La Hacienda Treatment Center for a number of years before starting my private practice. So fortunate to jump in and work with some of the best professionals in the industry. It was really, truly a blessing and truly amazing. In my private practice, I began seeing addicts in all stages of their disease and in all stages of recovery. And in 2015, I got my certified sex addiction therapist credential through ITAP and became a certified sex addiction therapist because even though I didn't have that credential before, when I was working in the treatment center, anybody that had a sexual issue was sent to me. I don't know why. I guess they just thought I was good at helping people recover from those, or maybe because of all of my own abuse. But they would send everyone to me that was having any kind of sexual problematic behavior or any history of sexual trauma. And so I decided to formalize that by getting my CSAT, and that was so rewarding and so beneficial. So for 11 years now, I've been specializing in sexual health and wellness, helping people thrive in their recoveries, work through their sexual trauma, work through their sexual addiction and problematic sexual behaviors. And it's been so, so, so beautiful. Now, my practice was thriving. I opened up the Shaw Center for Healing, which was the Sexual Health and Wellness Center for Healing. And in 2017, my husband at the time cheated on me. And I don't know if there's anybody joining us today that's experienced betrayal trauma, but man, betrayal trauma has been some of the worst trauma that I have ever experienced. And I have experienced severe trauma. The betrayal took me by surprise. We were in therapy. We were talking about our sexual relationship, opening up the relationship pod. We're talking about all that stuff, right? And behind my back, my husband decided to go ahead and just do that. And it was devastating for me. Betrayal trauma creates PTSD in the brain, just like other forms of PTSD. I was suicidal. I was angry. I was sad. I was all over the place. I didn't even know what to do with myself. I didn't even know what day it was. I was totally dissociated. The only thing I knew how to do was reach out to others who had experienced it. Now, get this. I'm helping guys, okay, that are in recovery from sex addiction that have cheated on their partners and their spouses. I'm helping them recover and I'm helping these couples recover. But I never was a partner myself until that year. And so I got to experience what it was truly like to experience betrayal trauma, which I would never wish on anyone. I think it's very painful, very, very, very painful. So I decided to go to treatment for my trauma because I needed to not kill myself, because I needed to be there to help people, right? So I went to a program for clinicians. That was beautiful. It was a 10-day program for other therapists that were recovering from lots of other things. And it was just a beautiful, 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 beautiful experience that was very helpful. When I returned, I said, let's work on this. I wrote those vows. I took those vows in sickness and in health. You're sick. Let's do the work. And we did. We tried for a little bit until he decided to F everything and run and leave town and ask for a divorce. So that divorce devastated me. It devastated me. Never in a million years did I see divorce in my path. I never wanted to turn out like my parents who had been through multiple divorces, right? And so it was traumatic, right? It was like he just packed up his stuff and moved to California, left me with the house, the boat, the cats, the everything, right? And here I am managing a healing center, right? And going through all of this trauma and divorce. And, my friends would say, Christopher, just put yourself on the dating apps. Just get out there and start dating and go have sex, go have fun, da 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 da. Right? Because in America, we really not taught how to grieve. Right? So instead of grieving, people just tell you to get back out there and put yourself back out there instead of feel the feelings. Well, what did I do? I got myself out there. I put myself back out there, and I ended up in three very traumatic relationships that were traumatic because like attracts like, and I was not in a good place. Right. And in 2019, at 11 years sober, I relapsed on substances. That was traumatic and it was devastating. I felt completely alone. And as a healer, I didn't know who I could tell. So I told my therapist, thank God for my therapist. Oh, I saw him for 10 years before he passed away from cancer. Every week on the couch, psychoanalytic therapy, couch therapy. I didn't even see him. He sat behind me, just tried to make me angry the whole time to pull up all my childhood stuff. It was brilliant. He helped me out through that time and it was really beautiful. And in 2020, I came back into recovery full force. But I still found myself getting into unhealthy relationships, repeating similar patterns, right? And these similar patterns were based on unresolved trauma. In 2024, at the tail end of a midlife crisis, yes, that divorce catapulted me into a beautiful 4-year midlife crisis. And we all know what that entails. It was horrific. Relapses, recovery, relationships, craziness, just all in there, right? And in 2024, I woke up and said, enough is enough. I am too old for this stuff. It's time to resolve it. Traditional helped me so much. My recovery community helped me so much. And my spiritual practices, they were kind of there, but they were really kind of lip service at that time. There was just a lot of layers and emotional constriction that was deeply embedded in my body. And so in 2024, I had had a friend who attended a psychedelic retreat here in Mexico. And when I got quiet enough to hear my treatment plan from Spirit, God, whatever you want to call it, Spirit said, you are to go to Mexico and do a psychedelic retreat. Now, being a person in 12-step recovery, I was always told that that was a big no-no, that if you do any kind of drug, that would be considered a relapse and you would have to start your clean date over. And my ego was so invested in clean time that I was like, okay, I just, kind of followed the rules like I was told. But at that point, I had tried everything. I had been on intensives. I had seen shamans. I had seen tarot card readers, mediums, ministers. I mean, you name it, right? And I still was hopeless. I still was hopeless because there were still more layers. So I did. I came down to Mexico, attended a 10-day psychedelic retreat where I healed with the sacred medicines of combo, bufo, and psilocybin. That changed my life. It dissolved the onion. It dissolved the onion. We weren't sitting around talking about my trauma or trying to figure out which layers had not yet been worked through. We just went right for the core of the onion with the sacred medicines, the facilitator, and the sacred container, and the onion literally dissolved. So I returned home with no onion. I returned home with freedom for the first time in my life. I returned home with clarity. I knew exactly what was next. And this beautiful medicine man in Mexico offered to take me on as a student because he was aware of all of my work over the years as a psychotherapist. I said, yes. How lucky was I to get to train with an indigenous Mexican medicine man who has been in the field his whole life. So I trained with him. I took courses. I did everything that I needed to do to be able to safely carry the medicine. So now, in addition to psychotherapist, I'm what you would consider a medicine carrier or a sacred medicine practitioner in Mexico where it is legal to do so. So my retreat was not magic, and it wasn't instant enlightenment, but it was a loosening, a softening, and a reopening. I reconnected with my body, and the trauma left my body. It left the fascia, it left the muscles, it left the cells, it just left. One of the biggest shifts for me was this. I stopped merely understanding my trauma intellectually and started processing it emotionally and somatically. And that really changed my recovery because trauma healing is not merely cognitive, it's embodied, right? And many people cannot think their way out of nervous system dysregulation. The body has to learn how to experience safety again. The psyche has to experience coherence again. And the heart has to reopen. And for me, psychedelic-assisted healing became a huge part of the larger process, a very important catalyst. And now Aeon will talk a little bit about what the research is currently showing us.
Thank you for sharing your story.
Sure.
All right, so now let's talk about the science. I'm sure as many of you know and have heard and have seen on the news, research into psilocybin-assisted therapy has expanded dramatically in recent years. Some of the studies that are what they're currently investigating psilocybin for is PTSD, depression, alcohol use disorder, addiction, end-of-life anxiety, treatment-resistant depression, and trauma-related disorders. Johns Hopkins, UCSF, Imperial College London, and multiple clinical research centers are actively studying these treatments. Much of the emerging PTSD research does suggest that psilocybin-assisted therapy may help reduce trauma symptoms while increasing emotional flexibility and psychological openness. Researchers are especially interested in how psychedelics may temporarily increase neuroplasticity, which, of course, I think most of you know is the brain's ability to reorganize and form new neural connections. When people experience severe trauma, the brain tends to become rigid, stuck in patterns of threat. The nervous system becomes conditioned toward fear, constantly looking for fear, avoidance, hypervigilance, and emotional shutdown. And many researchers now believe that psychedelics may temporarily increase the brain's flexibility, allowing people to revisit traumatic material from a different angle, a different perspective. This doesn't mean that the trauma disappears, but it does allow new emotional experiences involving that traumatic experience to emerge, more compassion. A lot of times people will report reduced fear response, increased emotional access, greater self-compassion, reduced shame, increased connectedness, and an increased openness to therapy. There's also growing evidence that psychedelic-assisted therapy may help disrupt maladaptive cognitive and emotional patterns involved in addiction. And importantly, the strongest outcomes consistently occur when psychedelics are paired with structured therapeutic support. So, not recreational chaos, not escapism, not bypassing, not peak state chasing, but support, preparation, integration, and safety. And those distinctions matter enormously.
There's also a lot of research on medications, and there are people who were on lots of medications before they embarked upon a psychedelic or a plant medicine retreat, right? And I know with our retreats, we have you come off all of the medications, or well, not all of your medications, but we have you consult with your doctor and our medical professional team. But most of the time, in order to do psychedelics, you'll have to come off certain psychiatric medications because they can interfere with the brain, and that will not be good for your recovery. Now, for me, I was on everything under the sun before my retreat. I mean, they had put me on an antidepressant, an antipsychotic, a mood stabilizer, a sleeping pill, a this pill, a that. I mean, I was on everything. And the retreat facilitator told me, you have to come off of all of that. And so I did not do that alone. I consulted my psychiatric nurse practitioner who helped me taper off things, and acupuncture saved my life. I saw my acupuncturist once or twice a week. With the help of acupuncture and Chinese herbs, I was able to safely, took me 3 months, but I was able to safely come off everything before my retreat. And since that retreat a few years ago, I have never had to take any of those medications again. Now, that's my story. It might not be yours. It is a common story, but it is really beautiful, and more research is definitely needed in that area. So now let's talk a little bit about the brain here. So what role do neuroplasticity, emotional processing, and nervous system regulation actually play in healing? Because this is one of the most important parts of the conversation. Trauma often traps people in repetitive loops, right? Fear loops, shame loops, avoidance loops, compulsive loops, and dissociation loops. The nervous system begins predicting danger constantly. For those of you that know IFS, that protector part is driving the bus to protect you, to look out for danger constantly. Psychedelic-assisted therapy may temporarily interrupt some of those rigid patterns. People sometimes describe seeing themselves differently, accessing compassion, revisiting trauma without complete overwhelm, reconnecting with meaning, feeling emotionally alive again. And many trauma survivors have never actually felt safe enough to fully feel. So that's crucial, because healing is not simply about talking about the trauma, right? It's about helping the nervous system safely process incomplete survival responses. This is why embodiment practices matter so much. Meditation, breath work, yoga, somatic awareness, nervous system regulation, relational safety, and community. Because healing is not merely neurochemical, it's relational, it's somatic, it's emotional, it's spiritual, it's behavioral. And let me tell you, with a psychedelic retreat, we also have integration and aftercare planning that is a huge part, right? A huge part of our retreat process. And Aeon is going to talk a little bit about what that's like. But let me just tell you, just like going to a rehab center for addiction, right? In the traditional model, they give you an aftercare plan, and they tell you if you don't follow your aftercare plan, the chances of relapse are very high. And it's similar with psychedelic assisted therapy. If you don't follow your aftercare plan, it becomes very easy to install those old programs that you deleted during your healing experience. So following an aftercare plan that's personalized and tailored to you is so important.
Yeah, I personally believe that aside from the ceremonial experience, integration is the most important, the key component to having a successful ceremonial psychedelic assisted experience. Because without the integration, there's no foundation for the insights to land and to then be incorporated into your day-to-day life, into the transformation that you experience during your ceremony. One of the biggest misconceptions in psychedelic culture right now is the belief that the healing comes from the substance itself. But it doesn't. There are so many other layers that are incredibly important to the healing container and to the psychedelic assisted experience. Because the psychedelic experience is the doorway, but what you bring into that doorway and how you walk out of it matters tremendously.
Yeah.
There is this growing tendency in modern wellness culture to treat healing like a certification process. People want the perfect protocol, the perfect dosage, the perfect facilitator, the perfect framework, but as though transformation can be engineered mechanically. But one of the deepest truths I have learned is this: you cannot certify surrender, because healing is not domination. It is not performance. It is not optimization. It is relational. It is relationship to the medicine, to the facilitators, to the container. It is the relationship that you have to your body, the relationship and awareness that you bring to truth, to your grief, this awareness and relationship to your fears, being able to see and recognize and integrate and digest them. It is the relationship to the parts of yourself that we oftentimes spend many, many, many years avoiding. Sometimes avoiding them so much that we have forgotten that they exist in the first place. And those fears are driving our behaviors, driving the way we see the world, how we react to the world. And we don't even know how to go back far enough to identify where the fear began. And that is what the psychedelic assisted therapy does. It clears all of the noise and it says, here it is. Let's work on it. And psychedelics amplify all of that, which is why the preparation matters so much. It's not just logistical, it's psychological, emotional, somatic, and spiritual. Because the preparation helps someone enter the experience grounded instead of fragmented. Because trauma survivors often carry enormous unconscious fear beneath the surface. Without the preparation, people can become very overwhelmed, destabilized, or even re-traumatized, psychologically flooded. So the preparation prepares them for the experience. Preparation creates the safety, intention. It brings in the nervous system regulation and emotional readiness to receive. And then there's the facilitation. The facilitator is not there to control someone else's experience. A skilled facilitator simply creates containment. They bring presence, safety, an awareness and an attunement to the field, and most importantly, ethical boundaries, especially in trauma work, because the nervous system often heals through co-regulation.
And so what can that look like if you are doing a ceremony with a facilitator who has his or her own way of doing things, right? And is not doing the work? How does that affect the client?
Well, I mean, for me, my primary goal as a facilitator is to maintain the container energetically and to be a witness to their transformation. Like, it's not my job to determine how they transform or what parts of them they connect, because that's their journey. My job is to create a safe container and a safe field for them to have access to those deeper emotional levels. I have a friend of mine who went to a facilitator in Los Angeles, and the facilitator required that he wear a face mask and headphones and listen to a specific track the entire ceremony. And that wasn't what his soul was asking for. So like that's when it becomes a co-regulatory, a co-created experience between listening and deeply with what this person needs and what they're asking for, and then providing them that thing in a very co-regulated way.
Yeah, yeah. Those of us that are trauma survivors, we can read a room, right? Like we can walk in a room, we can tell you who in that room is safe and who is not, right? It's like we immediately tune into everyone's auric field, right? And so when you are searching for a facilitator, it's a very good idea to meet them, right? A number of times before you just dive into a ceremony with them so you can feel out their auric field, feel out their energy, right? Because if a facilitator is not doing their own work, Just like this is the same as going to a therapist. The therapists that are out there that are not continuing to do their own work are putting their clients in danger. I'm just going to say that, right? Because there's a risk of an ethical fracture when you're not doing the work, right? And so it's very important in this space as well that the facilitators that are facilitating plant and earth medicine ceremonies are continuing to do their own work, are continuing to grow and learn as facilitators, right? That they are able to really create this energetic field of safety, right?
Hmm.
And that's what Alan was talking about, right? Because like if you're there and you need to be able to co-regulate, right, with somebody who is regulated. If you go into a ceremony and your facilitator is like, what? I mean, you're no, it's going to be
Dysregulating.
very challenging for
Yeah,
you.
yeah.
Right. Okay.
Oh,
Sorry.
okay. And then it comes to what I said a moment ago, which is one of the parts that's most important in this work is the integration, because simply getting the insight is not embodiment. You can have a profound experience. The medicine gives you a profound experience and still remain trapped in the same destructive patterns as if nothing changed afterward. I've had that experience. As I went through my journey with addiction and substances, before I ever found the rooms of recovery, when I was 26 years old, I sat with ayahuasca in the Amazon jungle 16 years ago now with the Shipibo shamans in northern Peru. And I was there for 6 months and did more medicine than I probably needed. And I thought that I was changed. Like I was glowing. I was in such a great, coherent, aligned state. But then I came back to the United States without any of the integrative support because they didn't offer that. And within 2 weeks, despite all the work I had done in Peru, I fell back into my old behavior again. So integration is where revelation becomes reality, where it becomes lived experience. It's where someone asks themselves, how do I live differently now after this experience? How do I regulate myself differently? How do I tell the truth? How do I repair relationships or let some relationships go? And how do I simply stop abandoning myself? Real integration often looks very unglamorous. It's definitely a lot less glamorous than the ceremony. But it does involve grief, boundary setting, continuing therapy, accountability, nervous system work, changing and shifting your behaviors. Though it becomes so much easier, though, to change and shift behaviors when you've done the deeper level trauma awareness work and you start to recognize, okay, this is why I'm behaving this way. And ending harmful relationships. So healing is not just about chasing the peak experience, it's about becoming more honest, regulated, embodied, and capable of intimacy. And ultimately, capable of a very deep state of presence that sometimes most people never get a chance to actually experience. And the medicine helps with that. But one of the dangers, I just want to say this, one of the dangers, though, in psychedelic spaces right now is spiritual bypassing. Using transcendent experiences to avoid unresolved psychological work. But genuine healing brings us more deeply into reality, more deeply into our bodies, more deeply into integrity, and more deeply into the relationship of being a human being. Because it's not always comfortable being a human being. It can be challenging. I think all of us know, especially who have experienced trauma. It doesn't take us away from it, but it roots us and grounds us into the human experience. So when we talk about psychedelic assisted recovery, we're not talking about escape. We're talking about learning how to safely return to ourselves.
Yeah. Returning to our capital S self, right? That beautiful capital S self, healing all of those wounded, traumatic parts, dissolving the onion once and for all. You know, I can talk about my trauma today and I don't have any reaction in my body. None. I talk about it like it wasn't even mine, right? Like I'm reading it from a book. It's beautiful that my body has healed and it has left my body, which is so huge, you know, because for so many years I did the talk therapy, but it never left my body until I embarked upon this type of experience, right? And so, what beautiful work what beautiful work is happening, what beautiful research is happening, what beautiful ways that the Mother Earth is providing healing for us. So now I'm going to talk a little bit about some of the risks, contraindications, and ethics. All right. Now, psychedelics are not appropriate for everyone, okay? Potential contraindications can include schizophrenia spectrum disorders, active psychosis, certain bipolar conditions, severe instability, certain medications, unsafe environments, or a lack of support systems. Possible risks can include panic, emotional overwhelm, destabilization, dissociation, reactivated trauma, spiritual bypassing, grandiosity, and dependency on altered states. I've worked with a number of people who they just switch their addiction, right, from a substance or a process addiction to chasing peak experiences with psychedelics, but they're not integrating, right? They're not integrating. And you ask them, how many journeys or ceremonies have you done this year? I had a client of mine recently who told me 50. I said, 50? Whoa. You know what I mean? That's a lot of medicine in 1 year. A lot of medicine in 1 year. And so what that told me is this is a person who's chasing the peak experience, right? Who's not really taking time to integrate what he's learned and what he's gained and what he's healed. Okay, unethical facilitation is also a very real issue in psychedelic spaces right now. This is why discernment matters enormously. Ethics matter enormously, and trauma-informed care matters enormously. No facilitator should position themselves as a guru, a savior, or absolute authority, because real healing work requires humility, boundaries, accountability, and informed consent. And psychedelics, they're not shortcuts around the lifelong work of integrity, recovery, embodiment, and emotional honesty. And let's take a moment to talk a little bit about what's going on in the USA. It is very exciting that federal funding has been provided to get the FDA to kind of get a move on all this research, and it's really exciting. And there are a number of states who are legalizing psilocybin, which is really beautiful. Colorado is one of those states. I will be in the process of actually becoming certified as a certified medicine practitioner in Colorado. Texas does not have that certification, and it is not legal in Texas, but in Colorado, you can, if you're a therapist, you can become certified to serve sacred medicine, the sacred medicine of psilocybin. And you take a course.
I was going to say, but the one concern that I have with that, because of the way the American Medical Association works and the Western medical establishment works, is the sterilization of the ceremonial aspect and the spiritual depth required to touch some of these deeper states without them being sterilized.
And that's a very valid concern. And there's a lot of, I think there's going to be a lot of growing pains as, the sacred medicines become legal. And the way that it works in Colorado is if you open up a healing center, a psilocybin healing center in Colorado, you are opening up a medical facility, right? So imagine opening up an addiction treatment facility that is like a detox, right? I mean, it's SOPs. I mean, it's a lot, right? So like, yes, there is a risk, that you go to a psilocybin healing center, and in some states, I've heard this is what it's like. You go into like a hospital-like room, okay, where they give you psilocybin in like a hospital room. Now, that to me sounds horrific. I would never want to do that ever. I think that would freak me out like big time, right? I'm like, ah! You know what I mean? I mean, psilocybin comes from the earth mother. I want to be in the grass or on the beach or in the sand or somewhere outside under the stars near a fire. And there are indigenous traditions that we cannot forget and that we should not banish. So I think there's a lot of learning
Mhm.
that's going to go along with that, and we will see how that goes. But there are states where there are actually psilocybin healing centers, and you can contact me. I can connect you with some of those places if you are in the USA. Here in Mexico, it is legal to heal with psilocybin and other earth medicines. And so we are here facilitating where it is legal because we do follow our code of ethics. And there's a risk that I'm seeing is that there's a lot of people with trauma addictions and all kinds of challenges that are finding psilocybin on the black market through like a psilocybin drug dealer, and they're doing ceremonies alone at home. And I would not recommend that. I would not recommend that for anyone, for anyone.
And then there's the additional risk of, people who've had one or two amazing mushroom ceremonies, and then now all of a sudden they claim to be a facilitator. And then it becomes this concern of the facilitator only really seeking the transactional nature of something that's being funded. And so that's why it's really important to practice discernment in where you choose to have this experience, and that you choose to have this experience with ethical facilitators who have all of these elements in place to prepare you, to keep you safe, and to help you with the integration afterwards. All of these elements are baked into how we operate as facilitators through our retreat service that we offer, because we have recognized through our own years of experience, over 15 years of experience for me, and then Christopher's years of experience as a psychotherapist. All of those things play a role in how we have structured how to hold containers safely for other people to have this experience.
Yeah. Yeah. And that is another valid concern when choosing a facilitator. But again, don't go out and do this alone unless you have really talked with somebody and had been guided right by the right people, right. For those of you that are in recovery, there's a beautiful 12-step program called Psychedelics in Recovery. You can Google Psychedelics in Recovery. I'll also email that to all of you. It's a beautiful 12-step program for those who are in recovery from addiction, who are also using psychedelics for healing and medicinal purposes, right. And so they ask that you have a base program and have a sponsor in that program. And then you can also get a sponsor in PIR.
No,
And it's
they're not called sponsors. They're called, oh, I can't remember what it's called. It'll come to me.
it's like a mentor, but it's like
Yeah.
it's like a co
Yeah.
sponsorship
Yep.
relationship. Yeah. It's really beautiful. So yeah, there's a danger, right? Like I've had friends who have come to me and they've said, yeah, I got some mushroom capsule. I did this ceremony. It was really scary and all these monsters. And I was like, oh, and I was just like, whoa. Well, right. I'm like, where did you do that? Oh, I did it in my bedroom when all my roommates were home. And I was like, oh, you know what I mean? I mean, there's just, no, don't do that. You're not putting yourself in a safe situation to do that work. And then what have you done to prepare for it, right? We talked a little bit earlier about all the preparation work that goes into being able to do that safely,
To
right?
even
Like
be
for me, it
open.
was
Yeah.
years and years of therapy before I experienced my first psychedelic healing experience, right? And I needed all of that therapy and all of the counseling and all of the coaching and all of the intensives and all the 12 step meetings. I needed all of that to prepare me for my psychedelic retreat, right? So it's just a little more complicated than just getting it on the black market and taking it yourself without really knowing what you're doing or without being super informed, protected, and safe, right? So we are not going to recommend that to anyone.
Well, that's the difference between a peak experience and a healing one.
Absolutely.
Yeah.
All right, we have about 15 minutes left, and so we'd like to open up the floor for questions and answers. And what I'm going to do, guys, I'm going to stop the recording here. Recording. All right, we are back from questions and answers. For those of you that are watching the replay, if you attend live, you get to do questions and answers with us. So Ann and I will be doing these every 2 weeks. They will have a little bit of a different theme. And so please stay in touch with us. And if you have found us on Eventbrite, That's where they will be posted. You can also find our events at archershaw.guru. And our website is not called archershaw.guru because we claim to be gurus. It is an ode to our guru, Nityananda, that we work with. So that's why we named it that. We've had some people being like, these guys are claiming to be gurus. We're like,
No,
no, not really what it's about.
not before.
All right, everybody. So if there's one thing we hope you take from today, it's this. Trauma is not weakness and addiction is not moral failure. Many people are carrying nervous systems shaped by overwhelming pain, and healing becomes possible when safety, support, emotional processing, embodiment, neuroscience, spirituality, and compassionate care begin working together.
And whether someone chooses psychedelic assisted healing or not, the deeper invitation is always the same: to stop abandoning yourself, to reconnect with your body, your emotions, your truth, your humanity.
So thank you all for being with us here today. If you'd like to stay connected, we would love that you contact us or stay connected to us. You can learn more about what we do, explore our future educational offerings, retreats, or even integration support at archershaw.guru. To learn more about our plant and earth medicine retreats that we offer in Mexico and beyond, please visit merkabaretreats.com. Now, I'm going to place our scheduling link in the chat for those of you that would like more time with us. So please, let me do that right now. Please, please, please schedule a 30-minute complimentary session with us. I'm going to do this. And then I'm also going to put in the chat the guide, the link to the guide. Okay, let's see, everyone here. There we go. So in the chat right now, you can find, it says download our guide. That's a beautiful guide that I designed that goes along with our webinar today. That's going to be very informative. Please share that with whoever might need it or want it. Then let's meet. That's our booking calendar. And then let's retreat for those of you that are ready to embark upon a retreat in the transformation of your lifetime.
And for those of you who are listening on our YouTube channel, you can find the links to all of those in the comment section.
Yes. So thank you so much for being here today. We wish you guys a great day. Thank you. Bye-bye.